Have you ever passed someone and wondered if they might be homeless and something about them didn't look right? And you thought, does this person need an urgent medical response? Have they possibly had an overdose? Okay, listen, if someone is moving, if they're standing upright, even if they're bent over in what some people call the fentanyl fold, they are breathing and they're likely okay. If they're not moving and there's community of theirs around, ask them, hey, is your friend okay? I'm worried about him. He doesn't look right. They will know what to do. But if they're alone, if they're not moving, if they're face down or in another awkward position, please take action. I'm Dr. Jill, and this is a reel not about how to respond to an overdose, but to give you courage to get help when help is needed. There have been awful cases of people dying in homelessness in a public place, with people walking past them for hours, sometimes even days before their death was noticed. And I don't know about you, but I want to live in a community that would never let that happen. So you're walking past, you see someone that you're worried about. You can say, hello friend, how are you doing? Are you okay? If there's no response, I'm worried about you. I'm going to touch your shoulder. I just want to make sure you're okay. And give their shoulder a shake. And if there's no response, take a closer look. Is their chest not rising with breaths? Are their lips blue? It's time to make an urgent and quick response. This is the most important thing. Call 911. Get help immediately. You can give Narcan and CPR if you're trained, but get help quickly. So a couple of things. People who are homeless are sadly used to having insults and even objects hurled at them. And in fact, they're more likely to be victims of violence than perpetrators of violence. So it's understandable that they might be wary when you approach. Starting with hello friend is an immediate way of letting them know you mean no harm. Also, touching someone without an invitation to do so can be very triggering for people that have had trauma. It is warranted if they are unwell and you're worried and they're not responding, but let them know you're about to do it. I have responded to many random people over the years, and even if they were totally fine and just having a nice snooze, when they knew that I was worried about them, they were grateful. Remember that one of the most awful things about being homeless is having people not acknowledge you, not look at you. So when they know that you stopped because you're worried, the message you give them is that their life matters. Now, a quick note on opioid overdoses. This is important. I'll cover it in another reel. But if someone is not breathing and you think they might have used drugs, give them naloxone. Naloxone or Narcan is an opioid antidote, and it can make you start breathing again. Anyone can be trained in naloxone, and you can even have your own kit for free and just carry it with you. Look online for resources in your area. And remember that a community is everybody caring for and watching out for one another. See you again soon.